Good afternoon, everyone. Thank you for joining us today. We have a lot to go over. We are seeing an increasing caseload. We are seeing increasing hospitalizations, and we are seeing limited to zero ICU space. So what does this mean for Mississippi, and where do we go from here? Joining us today is our State Health Officer, Dr. Thomas Dobbs, and our Chief Medical Examiner, well known to many of Mississippi's doctors, Dr. Dan Edney. So good afternoon to both of you. Dr. Dobbs, I want to throw it over to you to first of all discuss, could any of this increase be due to the 4th of July or the big baseball games, the playoffs? What are your thoughts?
Yeah, that's a fantastic question. And certainly it does seem to be a confluence of multiple events. And I have some slides I'd like to show you guys in just a second so that we can kind of see where we've been and where we're going. So I'm going to just crank those up, and that's probably a good uh, a good mechanisms to do it. All right, let's see. So if we just take a look and see kind of where we are, if you look at the number of cases and hospitalizations we're having, you're seeing that we're having a pretty significant increase in COVID patients over time. And what
I don't want to do anything to it.
and what we've seen is, when we went through the spring through May and going into June, we were doing reasonably well. But at that time, we were also really seeing primarily the Alpha variant or the UK variant. But going into the summer, the Delta variant has really taken over all the transmission within the state of Mississippi. We have multiple factors. If we think about the Delta variant coming through and it's being far more contagious even than the Alpha variant, combined with the increased activities through the summer, including the 4th of July and other sort of social activities, especially among youth. And then if we add on that our low vaccination rate and a high percentage of people, especially in younger age groups, who are not immune to COVID from natural infection or from vaccination, it really is kind of a perfect storm for an explosion in cases. I will go ahead and share my slides again. One of our biggest challenges is right now is that we're seeing an increasing utilization of our hospital space. Our number of cases is increasing rapidly. Our ICU utilization is starting to rise to levels not seen since last summer. And we're also seeing increased utilization of our mechanical ventilators. You can see that over the past month or so, you can see a sort of a snapshot of how much more intense it's been with the onset of the Delta variant. And we are going to one second, please. My camera is off. And if we look at the age groups, you can see here over time, you can see if we look at what's been happening over the summer, we see a pretty massive increase in the number of cases by age group, which is highly variable. And these are things that we'll share with you guys after the press conference. One of the most important things to say is the vast majority of our cases, our hospitalizations, and our deaths are in the unvaccinated. 93% of our cases over the past month are unvaccinated. 89% of our deaths in the past month are unvaccinated. And if we do a little bit deeper dive, it's important to note that of the deaths that are reported to us, all of the deaths in vaccinated individuals are 65 and older. That's one of the reasons why we've been very focused on trying to do additional protections for those who are 65 and older, understanding that even though the vaccine is highly effective and very safe, that they are somewhat at high risk, especially those who have chronic underlying medical conditions. For that reason, we also are advocating for people who have immunocompromising conditions, such as cancer treatment or lupus or other things like that, to talk to the doctors and see, do they need to be evaluated for a booster dose? There is increasing data out there that shows that certain sets of the population, not everyone, and not even necessarily age related, but people who have underlying medical issues, such as if you're on immunosuppressive drugs, if you're on cancer treatment, or if you're a transplant patient, that there may be some value in talking to your physician and seeing if a booster dose is an appropriate course of action. Y'all, we're going to have a rough few weeks. Delta is hitting us very strongly. We anticipate that we're going to continue to put additional pressure on the healthcare system. Currently, there are 13 hospitals in the state of Mississippi that have 0 ICU beds, and a significantly higher number than that have less than 10% availability. If you talk to your hospital administrators, docs, ICU docs, and ER docs, they'll tell you that we are getting to a point where we're actually having to fly patients from the Delta to the Pine Belt to get access to care, because there's really just not that much access to it right now. It's going to be a few weeks, so please be careful. If you're not vaccinated, certainly we want you to get vaccinated, but one of the things is important to know: it takes a while for the vaccine to be effective. So take some common sense steps over the next several weeks to reduce the risk of transmission of COVID. One of those is going to be, if you're doing something of a social nature, please do it outdoors. We know it's much safer if you do it under that sort of design. The other thing that we think you should do is be conscientious if you are over 65 or have chronic medical conditions, as we discussed previously. That's important to consider not attending mass indoor social gatherings of any form. Wearing masks is not a bad idea. Certainly, we think that that's a good way to add another layer of protection, and use some common sense. If you're older, or if you have chronic medical conditions, it's worth considering if the people who are coming to visit you, if they're kids or younger, have they been vaccinated, and could they be carrying COVID? Because we don't want people, especially those who are most vulnerable, to be exposed and look at have an unnecessary adverse event, hospitalization, or death. It's bad right now. Please exercise caution. We are in the middle, or maybe even the first part of our 4th wave. We want to bring as many people to the next side as we can. Thank you, Liz.
Dr. Dobbs, thank you for that. I just want to let everybody know we are having some technical difficulties getting your camera turned on, and we're working on that. And what we will do is I invite any reporters to, Marvin, do we look like we're getting close? Okay, I think we're getting close to having Dr. Dobbs on, but I invite any reporters to ask anything about what Dr. Dobbs said. Feel free, so that you can get him on camera. Hopefully by the time our Dr. Dan Edney is done, we'll have Dr. Dobbs up. So Dr. Edney, can you talk, first of all, a lot of reporters, a lot of the reporters, and Dr. Edney has done a lot of work statewide, and he's well known by providers. And he is actually doing some very important things with providers right now. But first, I want you, from your personal experience as a physician in Vicksburg, to talk about what it's like when a hospital is overwhelmed. You've dealt with it. I think it'd be good for us to understand that and for the public to understand that. Could you talk to us a little bit about that?
Sure, and thank you, Liz, and thank you, Dr. Dobbs. Pleasure to be with y'all today. As I think back over the last year, some of the most difficult days I've had in the practice of medicine have been in the midst of getting through late November, December, and January earlier this year. Those are, we called, and many times in our practices, we call those the killing times, because that's when we were just seeing just the virus attacking families wholesale, related to Thanksgiving and Christmas holidays and family gatherings. I specifically remember one day I had 2 patients who were very close to needing the ventilator that we were trying to transport to the hospital, and they each were in the back of their own ambulance, and they had to stay in the back of the ambulance 5 hours at the hospital waiting for the ability just to get into the emergency department. And then once individuals were in the emergency department, it would be days before they could get a hospital room. And of course, during that time, families were not allowed in. There were no ICU beds. We were not just transporting patients around the state, we were transporting patients from Mississippi to Texas, Mississippi to Florida, to try to get ICU beds. And most of the public don't really understand how close we came in that second week of January to the healthcare system just breaking from the stress that we were under. Thankfully, vaccines arrived in terms of enough vaccine to start vaccinating those who are most at risk, those over 75. And as soon as we started deploying vaccine to the general public, the numbers started to calm down and the stress started to be relieved off of our healthcare systems. And it was not just the healthcare systems that were under stress, it were the families of the loved ones who were in the hospitals alone. Those who were stressed at home that normally we would have had in the intensive care unit, we're having to treat them at home because there were no beds. The stress of doctors and nurses all over the state on the front lines, other healthcare workers going through all this, and then the stress of our families who were worried about us on the front lines. And of course, we were worried about taking COVID home as well. Thankfully, we were vaccinated by that point. These experiences all have brought home in vivid detail to doctors and nurses across the state just how serious this was. And now we're dealing with a variant of COVID that is twice as contagious as what we were dealing with before. So we just don't need to go through this again. I had an employee in clinic who teared up and told me, I can't go through this again. And we have an answer so that we don't have to go through those killing times again. And that's vaccination. It's very simple. If you're eligible to be vaccinated, get vaccinated and wear a mask when you're in situations where you're around a lot of people that you don't know their vaccine status. We have an exit ramp from this pandemic. We just need to take it. And the health department is doing everything that we can to facilitate vaccinating the general public. Everybody who's familiar with the yeoman's job that our National Guard and health departments did around the state and our mass vaccination clinics, well, that's over with now. And now we have just a much lower demand for vaccine. And we're having to basically convince people one at a time that the vaccines are safe and highly effective, as Dr. Dobbs has pointed out. And we're doing that by getting vaccine everywhere that we can. That includes doctors' offices now. And we have enough vaccine that physicians anywhere in the state have the capability of becoming vaccine partners with the health department, becoming registered and having vaccine delivered to their individual clinics to administer to their patients at the time of an office visit, if they so choose. We are seeing a lot of patients that are still sitting on the fence. They just don't know. They're hearing so many different things. They're hearing from doctors that it's safe and effective, and they're hearing from Facebook practitioners that it's going to kill us all. And we are here to tell you, as America's physicians, 96% of us are fully vaccinated voluntarily because we know it is safe and we know it's effective. And Dr. Dobbs has already pointed out to you the efficacy based on those who are suffering most right now, and that's the unvaccinated. And this is totally preventable if we can just convince our patients to get vaccinated. We know the number one individual that can do that is the patient's personal physician or provider. And we need these conversations to be held at the time of office visits. We need you to call and talk to your physicians. Physicians matter, and they desperately matter in this situation of vaccine hesitancy. And I've seen in my practice that patients oftentimes just need to talk to me. They don't know who Dr. Fauci is. They don't know who the talking heads are on television, but they know who I am. And they know that I've been with them for 30 years. And they know if I'm vaccinated and my family's vaccinated and I want them to be vaccinated, then they can trust me. And many have chosen to be vaccinated after talking to me. So we're encouraging our physicians and providers around the state to sign up and become vaccine providers and provide it at the time of the office visit, just like the flu shot. If you're looking for where to get a vaccine, they're readily available and they're free. And you can go to www.vaccine.gov and look in your community where vaccine is provided and what type of vaccines, as you have a choice of the three. And then you'll be able to see if your local doctor is providing the vaccine in his or her clinic. We are working hard to get our children vaccinated by having increased access to the Pfizer vaccine through health department depots. The health department around the state are providing access to clinics so that they can get doses as few as 6 at a time. And the big struggles before were the difficulty in private clinics being able to handle the volume of Pfizer vaccine that was required by the government. But your health department has worked hard to solve that problem. And so pediatricians and family medicine docs should be able to have Pfizer in their office to vaccinate those 12 to 18-year-olds. And we are asking our providers, our physicians around the state to consider our Adopt a School program, where you will help volunteer to get our school-age children whose parents are willing and wanting the vaccine for their children to facilitate vaccination of our school-age children. We know that vaccinating our children will make school much more safe and more normal. If we want this fall to be more normal, the route is through vaccination. And we at the health department have been working tirelessly to provide vaccine in every way that we can. If you have questions, you can look at our website regarding the Adopt a School program and the CCVP part of our website for providers who are familiar with that, or you can call me directly, contact me directly, or you can call the health department 601-576-7751. Thank you, Liz.
Thank you, Dr. Edney. Thank you so much for your insight. I don't know if you said this, but the important thing, if the media could help us try to enlist providers, because as Dr. Edney said, and we know this from surveys, people trust their doctors the most, and they can be a big help. And also, you can order as little as 6 vials or as many as you want. We've cut down the number that you can order. So if you only have a few patients that you want to vaccinate at this time, we can accommodate that. So please seriously think about signing up as a provider and also adopting a school. So we will go to the questions. And Scott Simmons, I noticed you said, can we see Dr. Dobbs? We can see him finally. And so y'all ask any questions, like I said, that if you need Dr. Dobbs on camera about what he discussed before. Okay, so Rachel Rubin with Politico. Hi, Rachel. I was wondering whether the state is tracking breakthrough cases, even if the individual isn't in the hospital. What guidance has the state received from CDC on tracking breakthrough cases? Dr. Dobbs, is it correct to say providers are supposed to let us know about breakthrough cases?
Yeah, no, absolutely. And, you know, we do, we collect the information for every new case, right? So we're tracking every single case. And then for there, try to see if that person is vaccinated or not. Additionally, if someone is a breakthrough case, we are requesting that those samples be sent to the state public health lab so that we can do sequencing to identify if it's a variant or what type of variant it might be. You know, as I showed in the slide before, that's how we're telling if we're having breakthrough cases. You know, we had basically 93% or 94% of the cases are in unvaccinated. It's that other subset. It's that minority number of 93% of folks are unvaccinated, and it's that 7% that are vaccinated that are considered our breakthrough cases.
Okay, thank you. Nick Juden is asking, can you go into more detail about the increased infectivity of the Delta variant? Can you, for example, give us an example of a passing encounter that would not have spread the wild type COVID or even the Alpha variant, but that could result in a Delta infection? What guidance should individuals follow to protect themselves above and beyond vaccination and masking? So Dr. Dobbs, you want to start that, and then Dr. Edney, if you want to jump in.
Yeah, so we know the Delta variant is far more contagious than previous. So the Alpha variant, also known as the UK variant, was going to be like 50% or so more contagious than what we had seen in the first parts of the pandemic. And then with the Delta, it might be, 50, 75% more contagious. So what we're looking at is a virus that's about 2 times more contagious. So what does that mean? It's you can't say how much of an exposure it would take to get infected, but you just got to understand that your risk is doubled. It's like rolling the dice, right? And since it's that more contagious, since the way that its mutations are designed, it's that much more sticky, trying to bind onto the entry sites of your body. that you're more likely to get sick with it. So, it's just going to take less exposure, less time, and more opportunity for sort of super spreader events. The other thing that's important to know, and is part of the challenge, is based on studies, it looks like the immunity from natural infection is not really that great against the Delta variant. Fortunately, the vaccine looks pretty robust. There's a mild diminution in effectiveness for Delta, but for natural infection, the natural immunity that you got from an old COVID infection is not really that great against the Delta.
Dr. Edney, do you have anything to add?
No, it just as a clinician, it's very concerning that we've watched the stages of these variants develop because it's been transmitting through our population almost at will. And it gives me great concern of what Lambda will be if we don't get our vaccine rates up to calm this transmission down. This bloke's getting too smart too fast.
Thank you, Dr. Edney. So Keisha with the Clarion Ledger. With COVID-19 cases back on the rise and hospitalizations becoming an issue again, does MSDH believe things are getting bad enough to warrant recommending that vaccinations be required for all students and staff in both K through 12 and college university settings who are eligible? So Dr. Dobbs, talk a little bit about those guidelines we just put out for schools, I think the week before last.
Yeah, so we did release the MSDH state-specific K-12 guidelines that are aligned with the CDC guidelines. We will use that as our guide for other critical components, including case investigation, isolation, quarantine. So it's really important for families to know that vaccinations are safe, they're effective, and for kids, they're really effective. I mean, in the studies previously, it looks like it's almost 100% effective. And if kids are immunized, if they're vaccinated, then they don't have to quarantine based on these guidelines, and they fall outside the recommendation to wear masks in school. Now, as far as mandatory vaccinations, that's not something that we're going to be looking to pursue. There's a lot going on right now. We do recommend it, and we're going to do everything we can to make sure people can make the right decision. It's not seeming really feasible to promote that. Also, typically, even though we don't think that the FDA full approval is going to change it all, and we think that we're getting some information that they may be accelerating that review for good reason, that we would really ever consider any sort of mandate without full FDA approval.
Okay, Dr. Edney, do you have anything?
No, that's covered well as usual.
Okay, and I just want to remind people, Jim Craig couldn't be with us today, but he has worked on testing sites that are available outside our county health departments. And it's very important for students, but like people that take care of groups of people that can't be vaccinated, like teachers or any other school staff or healthcare providers or emergency workers, to make sure that they are not spreading the COVID virus. So if you have any symptoms, even if you have been vaccinated, please take advantage of those testing sites. Let's see. All right, this is Emma Court from Bloomberg News. The CDC has described this as the pandemic of the unvaccinated. Are you seeing any further demographic trends among those who are being hospitalized? Dr. Dobbs, why don't you take that? I know you had the slides up, but why don't you talk a little bit about that, because you weren't on camera.
Yeah, so it really is in Mississippi also, the vast majority of our new cases are unvaccinated. Let's be very clear, they're unvaccinated. Now, we are seeing some cases among people who are vaccinated, but it is a minority, but obviously it is concerning. I think the thing that's most concerning is if we look at by age group, and we're seeing, if you look at the deaths in the vaccinated folks are 65 and older. And from looking at more individual cases, we are seeing evidence of lack of immune response in the people who have weakened immune systems. I got some notification about dialysis patients that had similar issues. So we really are strongly encouraging folks to talk to their docs about getting a booster dose. We're actually looking at seeing if we can make booster doses available at county health departments for doctors to make that referral. So stay tuned. That's something that's in the works. And then age. And that's one of the reasons why with the age situation, we did make those special recommendations for older folks and people with with chronic medical conditions to take extra precautions during the period of this Delta surge.
Okay, Will Stribling from Mississippi Today. Is MSDH making any recommendations about how schools can actually enforce these guidelines? Of course, we've made the guidelines. It seems like differentiating between unvaccinated and vaccinated individuals in the 12+ age group will be difficult to do. So we have made the guidance, the recommendation. Can one of you guys talk about the enforcement issue?
We're working with schools to find the best path forward. There are some options like, here at the Department of Health, we do self-attestation, like an affidavit almost, if you don't want to wear a mask. And so there are mechanisms like that. We are also having talking with our CDC colleagues to see if they have any specific recommendations and maybe some other options, but we're continuing to work through this with our school partners.
And will MSDH be requiring or asking schools to report COVID numbers like they did last year? Will MSDH be making that data public as it did last year? I can tell you if we request it, we will make it public. As always, Dr. Dobbs?
Yes, we will continue to work with schools to report cases and outbreaks so that we can help them respond. And to be very clear, that we must continue to isolate individuals who are contagious with COVID and have our quarantine strategy so that we can limit outbreaks.
Okay, Dr. Byers said in his presentation to school officials last week that if an unvaccinated individual is exposed, an alternative to quarantine is to test that individual every 2 days for a 7-day period. As long as he or she remains negative, that person could avoid quarantine. Is this an official recommendation, or where did that recommendation come from? Gentlemen?
That is an official recommendation. That is within the guidelines. There's also one where you can, if you're quarantined and you get a test toward the end of the quarantine period between 5 and 7 days, you can go ahead and go back. I can't remember where this was derived, but we can get with Dr. Byers to see what the source of that was. But that is our guideline.
Okay, and will the Department of Health release guidelines for Mississippi universities? Have we worked with IHL at all?
We have had meetings with them to make sure that they're prepared. The same principles that are at play with the K-12 in some respect do make sense. But we are hopefully getting more details and guidance from CDC soon, but we will work with the IHL and other colleges to put together Mississippi specific guidelines.
Okay, and finally, Dr. Dobbs said in early June that he does not think a vaccine mandate is needed for university settings. Has that opinion changed in light of the Delta variant case numbers?
Without a doubt, the immunization is that much more important to have a successful college year, to keep kids in class and our teams on the field. But we are not looking to pursue any sort of mandatory vaccination.
Okay, Allison Span from WLOX is wondering about allergy testing and COVID. Is there a process in place for COVID allergy testing, guys?
No, it's just in terms of allergy testing for the vaccine itself, we really have seen no problems, whatsoever. The only real allergy we worry about is allergy to polyethylene glycol, which is exceedingly rare. But in the 2 million total doses that have been given, we have just not seen true allergic type reactions. We've had normal vaccine type reactions, but we just haven't seen anaphylaxis or severe allergy reactions to the COVID vaccine.
Yeah, thank you, Dr. Edney. Dr. Edney actually worked with all of our nurses as we were vaccinating on people, on our patients who had questions. He was the one who advised them. So I had forgotten that, but yeah, actually it was very, very low, as you said. Kingfish is asking, what are the population vaccination percentages by major racial groups in Mississippi? All right, Dr. Dobbs, do you want to start with that?
Yeah, so if based on the percent of the vaccine that has been distributed, the breakdown is pretty similar for white Mississippians and African Americans. 30%, 37% of our vaccine has gone to African Americans, and that mirrors the population percentage. So about a third of African Americans have also been vaccinated, as have been white Mississippians. We are lower than that for our Hispanic populations and a little bit higher for our Asian American populations. We can get you those precise numbers, but it's pretty simple to back calculate from our immunization report.
Okay, let's see. From Kelly Roberts, wondering if I could get this in. What's the latest on pediatric ICU cases, and did that influence MSDH's guidance for schools?
The school guidance was already out there, and so it didn't really change. So no, we're happy to report that most of the ICU cases have been discharged, although we still have two who remain in ICU who are pediatrics.
Okay, Courtney Ann with WLBT. What potential steps or restrictions are being considered to improve are considered to preserve the integrity of the healthcare system? Dr. Edney, do you want to kind of take that first? Maybe some of your thoughts on what could be done to preserve the healthcare system?
Well, we know from experience what works. The COVID system of care works very well. And we talked to the hospitals already in the last few days that, we're having to watch as ICU capacity goes down and asking them to voluntarily cooperate with each other to manage their beds efficiently. But if push comes to shove, we'll go back to the COVID system of care, which is centralized management of the ICU beds and hospital transfers, which, as Dr. Dobbs says, we told them we don't like to do it, but we know it works, and we'll do whatever we have to preserve the integrity of the healthcare system. However, with vaccinations in place, I just can't foresee, outside of a catastrophic event that we don't anticipate, getting back to where we were the first week of January, especially if we keep escalating our vaccination numbers. If we can push a little harder, a little faster, then we certainly will protect our healthcare system. But really, it's dangerous to even approach where we were the first week of January. We don't even need to get close to that again. So that we'll be doing everything that we can to protect the integrity of the healthcare system, including COVID units if they have to open back up. Every hospital had COVID wards, and if we have to restrict unvaccinated visitation, hospitals will just have to do what they have to do to protect the healthcare system. But we learned through the worst of times what works, and we'll get through it again if we have to.
And so I think, Courtney, we got that second question answered. Dr. Dobbs, does the Delta variant complicate all of that?
Oh, absolutely. I mean, it basically makes us sort of reset, and we don't really have the same degree of population immunity to help us out like we did in the late part of the spring, early part of the summer. We're just seeing big outbreaks. We're seeing a lot of cases in kids, and we're seeing it translate into severe illness, death, and hospitalization for middle-aged and older folks. Yeah, no, absolutely. It definitely complicates things.
Okay, and let's see, Zanetta from WREG. Can you provide an update on the case investigation at Bedford Care, Monroe Hall, and Landmark of Collins? Have you all established the origin of the outbreak? We have, and it was an unvaccinated, it's unvaccinated staff. And have there been other significant breakthrough cases of long-term care facilities? Dr. Dobbs, we were talking this morning about greater than 50 cases, not all at long-term care facilities. Were those Delta variant?
Yeah, so we've seen right now, a few weeks ago, we had less than 10 long-term care and residential facility outbreaks. Right now, we're looking at over 50. Again, something we anticipated and we knew was coming. And so we've seen a lot of investigations that have been going through there. Everything we're seeing now, based on our surveillance, is going to be Delta, the vast majority of it. So pretty much all the cases we're seeing right now are Delta variant.
Okay, and Dr. Edney, I'm going to start with you on this next one. I want your take on UMC's decision to mandate vaccinations for all employees once the EUA is lifted. UMC tells us they will be double checking the vaccination status of employees by using MSDH data, and that is available. Is this something additional healthcare facilities and even other businesses should pursue? And will MSDH assist in these endeavors? Dr. Edney, give me your take first as a clinician.
Sure, and I'm speaking as an individual Mississippi doctor. I'll let Dr. Dobbs speak for the agency, but it's my opinion that physicians and other healthcare workers who are providing direct patient care have an ethical responsibility to protect our patients at all costs. And for me, that includes protecting them against me giving them COVID, or protect them from me getting COVID in one healthcare setting and taking it to another, which we saw a lot back in the fall when people were working in different environments. As a physician, I just considered it my ethical duty to remain on the front lines as long as I was needed, and to be safe in doing so, which meant I wore full protective gear to protect myself, my family, and my patients. And then when vaccines became available, we were on the very front line of taking those back when very few had taken it. And we did so out of a sense of ethical responsibility to protect our patients and not to be sources of transmission. And so as a healthcare professional, I think it is part of our mandate that we need to be safe as we provide healthcare. And for me, that means being vaccinated.
Thank you, Dr. Edney. Dr. Dobbs, did UMC talk with you at all about their decision?
We talk to them on a regular basis, and we didn't have any active role in deciding, but certainly we do think this is going to be an effective way to help protect their staff and their patients. Now, keep in mind, these sorts of things are not really uncommon. These sorts of activities are already pretty routine for infectious diseases such as hepatitis B, or for measles, or for influenza, tuberculosis, those sorts of things. So this fits well into the long-standing infection control practices that are really of paramount importance for healthcare settings. The other thing is, we do know that court rulings have sort of validated that entities can do mandates, and I do think that UMC did a pretty good job of striking a balance, between doing everything they can to protect folks through immunizations and infection control practice.
And Nick is asking, is this something additional healthcare facilities and even other businesses should pursue? So you kind of talked about healthcare facilities and infection control, but what about businesses? Dr. Dobbs?
Certainly something that they have the wherewithal to do. I mean, there's a whole complement of preventive measures you can do, and certainly this is one of them. We know that immunizations are some of the most effective things. So, if that's something that a business wants to do, it would help them prevent transmission within their facilities.
Okay. Thank you. Isabel Murray with the Sun Herald is asking you, Dr. Dobbs, do you recommend Governor Reeves enforce another mask mandate ahead of the rough upcoming weeks?
We have other tools available to us, and in all honesty, I think that the era of statewide mask mandates is probably over for the majority of the United States, and certainly for us. So I don't anticipate that's an option. But there are other things. People have a lot more opportunity to make the right decisions for themselves and their family, whether it comes to, getting this safe and highly effective vaccine, whether it's, making sure they avoid mass gatherings, and folks who are highly vulnerable being careful. And we know that there's several ways to do things, such as doing social events outside. And we got to be really careful. I do want people to be understand where some of the highest risk is, especially for our youth. It's going to be in those situations where you have a bunch of kids in an enclosed space for a long time. And we've seen a whole bunch of cases and outbreaks in like youth vans where they're driving across state, or indoor activities or parties or social events, or, classes that people have over the summer. So we know there are other ways to prevent it, and we want people to, exercise whatever, collection of options they have. And certainly if a locality wants to do a mask mandate, that's another tool they can use.
Okay, Scott Simmons is asking, Dr. Dobbs, why is the fourth wave spreading so quickly? Is it faster than the first wave? Also, should schools rethink masks and other restrictions? So Dr. Dobbs?
I don't know that I think it's really any faster, but certainly once Delta hit us and we had sort of like a pretty opened up society, especially for our kids getting back into normal activities that they've been so desperate for, it really was sort of like it's a perfect storm for rapid transmission. So we've seen a lot of that for that reason. And then after the 4th of July, we're not really looking at rethinking masks and other restrictions at this time. We're going to try to align with CDC and be actively engaged with them. And if they make a change, we'll obviously get with our schools and consult with them.
Okay, Dr. Edney, Emily from AP is asking, and we talked about this earlier today, the Neshoba County Fair begins soon. What are your recommendations for the anticipated crowds there?
Well, if you're unvaccinated at this point, it's too late to become fully vaccinated before the event. And even fully vaccinated individuals, that certainly if you're over 65, I think you need to double think it. If you're going to be in any crowd setting, not just the Neshoba County Fair, but any crowd setting, you need to try not to be in the middle of things and be as distant as you can, open air as much as you can, wear a mask, and be vaccinated. And in terms of how to be fully safe in an environment like that, I don't know that you can, but the mitigating tools that we have that Dr. Dobbs has said need to be fully employed for situations like this. And I think it's going to be true for football season that's around the corner. Delta is still very active. Be vaccinated, wear your mask, distance as best you can, and stay open air as much as you can.
And get vaccinated. Okay, let's see. This is from Rebecca Torrance with Bloomberg News. What progress has been made since the beginning of the pandemic that might allow the state to better tackle the Delta variant? And what necessary steps are still missing that make addressing it so difficult? Dr. Dobbs?
We don't have enough immunity. We just don't. If you look at serosurveillance studies, especially among our youth, 72% don't have any immunity from natural infection. And so we know that 3/4 of our highest risk folks are not immune, and we don't have near enough folks who've taken the vaccine. And that's driving the spread. It just is. That's basically the first 3 answers that we need to have. I mean, are we doing the other things? I mean, testing is pretty widely available. That's not the challenge like it was initially. Contact tracing has a limited capacity to really interrupt transmission. It does have a role, but it's that much more difficult when you have such a highly contagious variant. What we've seen with Delta is where normally we might see 2 or 3 transmission cycles within a small group or family, and now we're finding extensive webs. We find a case and we can link it to multiple families over multiple exposures because it's that much more contagious, and it's a lot easier to sort of track it down in these massive outbreaks. It's a different animal, but our answer is to be immune. And we are just not anywhere near enough immunity to prevent ongoing outbreaks.
Courtney Ann Jackson from WLBT is asking, is there anything that could change guidance for resuming in-person school in a couple of weeks?
I don't know that there really is. We learned a lot last year with COVID, and we know how very important it is to keep kids in school. So I think if we really want to work closely with the school districts to make sure that they can do those things to keep kids safe, we do have a different set of strategies, including, we do want kids to take the opportunity with their parents to get vaccinated. Keep in mind, it's very, very safe. Haven't seen really much bad for anybody from the vaccine. We've given over 1 million folks immunizations and have not been able to verify a single death from the COVID vaccine in the state of Mississippi, whereas we've seen almost 8,000 deaths from COVID, right? So look at that. And if we look at some people are worried about myocarditis, which is not unfounded, but the risk is extremely low. We've had 3 cases who've been, honestly very mild and have recovered quickly. And you're much more likely to get myocarditis from COVID than from the COVID vaccine. And the thing that we've said before, and I really do think it's true, especially now that we're going through Delta, is that you're either going to get the vaccine or COVID. And we know that COVID kills you, and COVID causes a lot of issues and chronic problems. So definitely the best way to go forward. We're also going to offer school districts to take advantage of weekly surveillance testing for kids who are not immunized, so that we can more quickly respond. So we actually have more tools in our tool chest than before. And we also have a vast understanding of what can be done safely in schools, because we, like a lot of other states in the South, opened up for a lot of in-person stuff last year. We have an extensive experience in that.
Okay, Sarah with the Clarion Ledger is asking, what is the updated number of Mississippi children who are in an ICU with a COVID infection? And you just gave that, Thomas, right? Was it 2?
Yes, exactly.
Okay, and are they both on ventilators?
I don't have that updated information at this moment.
Okay, and did we give an updated count on identified Delta variant cases?
It's a surveillance process, right? So we don't test
Right.
every positive for,
Right.
sequencing, but we have identified so far 365 isolates that are Delta, and that is the vast majority of our recent isolates.
Okay, and is that surveillance from a particular area, or is it throughout the state?
It's throughout the state. I mean, there's
Okay.
a heavier concentration in the Jackson metro area, but there are representative samples from across the state, and they're Delta. It's everywhere.
Okay, we need providers to do that sequencing, don't we?
Yeah, well, there's certain folks, especially people who might be breakthrough cases or reinfections. It's in our Health Alert Network message that we're going to try to send out another reminder within the next day or so.
Okay, thank you. Kingfish is saying, although hospitalizations and ICUs are surging, the chart on your website shows deaths as being flat through the middle of July. Do you expect deaths to rise or stay the same, Dr. Dobbs?
Definitely expect for them to rise. This is the same thing we saw before. Deaths will typically follow case rises in about 3 to 4 weeks. Because if you think about it, you have a case and it takes usually a couple of weeks to get sick enough to be hospitalized. And then you can be hospitalized for weeks, even months before people sadly pass away because, trying heroically to keep people alive. That's one of the reasons why it overwhelms the healthcare system so much, is because once someone gets so sick and needs life support, to survive, they need weeks and weeks often on a ventilator, on life support to get better. And they can get better, but it really is not usually a quick trip to life support. It's usually a long-term situation.
And they're never the same.
Mhm.
And there's the previous trend, the old trend was about 2 weeks after the real boost in numbers is when we'd see the deaths start going up. But what's different now, which I'm praying will impact deaths in a positive way, is that our treatments are so much better than they were back in the fall. We have very effective therapy with monoclonal antibody therapy. And if you are positive, if you're a COVID positive case and you're higher risk, you need to talk to your doctor about getting monoclonal antibody therapy, which is very effective. And then also our intensive care work is so much better. We understand treating critically ill COVID patients much better than we did 6 months ago. And a lot of folks, we're still seeing a positive impact from vaccinations, keeping people from getting as ill as they were.
Okay, thank you, Dr. Edney. Let's see, Dan Goldberg, are you recommending any capacity restrictions or limitations on indoor gatherings? I think, Dr. Dobbs, if I recollect, we did do some guidance on indoor gatherings for those over 65. Is that correct?
Yeah, we do recommend that all unvaccinated folks do wear masks for indoor gatherings. And we also recommend that people are 65 and older or have chronic medical issues avoid indoor mass gatherings.
Okay, Dan Slotnick from the New York Times. Has the state of Mississippi reached out to the federal government for help with current outbreak, for example, with the surge response team? How could the federal government help the state, or would its efforts more likely be counterproductive? So I know, Dr. Dobbs, I remember you and Dr. Byers talking with the White House about smaller packaging. Have you worked any more with them?
Yeah, we maintain regular communications with our federal leaders. the thing that we really need is more folks vaccinated. I mean, that's what we need. I'm not sure that the federal government can help us with that, and I think it actually could be counterproductive. Um, I think everybody understands the situation we're working through, especially in a lot of our deep southern states. Um, uh, we are able to do the case investigation, the contact tracing, all that kind of stuff. Our nursing home evaluations, it's really just a matter of having enough immunity in the population, and we're choosing to do it the hard way. It'd be much easier and safer if we just get more folks vaccinated.
So why do you think it, you said you think it could be or would be counterproductive? Why? Just because we know what we're doing now?
If it's to get more folks vaccinated, there is, obvious pushback about federal involvement right now from some of the most resistant groups.
I
So
gotcha.
I don't know that there would be much to be added there.
I got you. Thank you. Trevor with Inside Edition. Given that many states have an oversupply of the vaccine right now, and that Mississippi has had to return or reject 872,000 doses, what can states do to make sure their existing shots get in arms, whether in state or not? So I don't necessarily like the term reject. We certainly, they never came to us. We just didn't order them and they went back into the federal pool. And our mission here in Mississippi, and Dr. Edney, I'll throw it to you because you're working with providers to get this across, is we want shots in arms. The waste is not the issue. We have plenty of vaccines. So we want shots in arms. And I think, Dr. Edney, why don't you talk about that a little bit?
Sure. And, we do care about stewardship, but patients are more important. And as Dr. Dobbs says, one shot in the arm is better than 10 on the shelf. But still, our partners are very good stewards of this precious resource. And the stewardship of our central vaccine program is very good in terms of moving vaccine that's in circulation now into places of need before it goes bad. So we're being very good stewards of what we have and using it to the most effective means that we can. But what's most important is having vaccine available at the point of care where patients and their families are, where we have the ability to contact and communicate with them and work on vaccine hesitancy, and then vaccinate immediately should they choose to receive it. So, I'm grateful as a physician that there is an oversupply of vaccine. It's allowing us to cast a wider net versus where we were 3 months ago when we were having to be husbanded very dearly. Now we can be much more aggressive in providing vaccine in more places.
Thank you, Dr. Edney. Jackie with Fox 13 in Memphis, can you talk more about how you, Dr. Dobbs, are considering this current spike in cases the fourth wave?
Yeah, well, if look at the deaths curve, right? Our first wave was in the spring when we had a whole bunch of deaths, and our testing just was not capable of picking up all the tests, all the new cases. And then we had another wave where we did pick them all up with tests in the summer, and then we had this other wave in the winter. There was a disconnect between tests and deaths that was due not to cases, but it was due to lack of testing capability. And so, yes, this is our fourth wave.
Okay, Shirley, who's a freelancer, is asking what specifically is the MSDH doing to assist people who have problems accessing the vaccine, like people who do not have transportation or those who are homebound? Well, I know Jim Craig is listening. A big effort has been out there, Shirley, for many weeks now, where we do pop-up sites, we have testing sites, and we publicize them a great deal in those rural areas and in those vaccine deserts. And we will work with folks who don't have transportation, and especially those who are homebound. You can go check our other press conferences out to learn more about that. And it's also on our website. And yes, we do partner with the community to not necessarily do door-to-door vaccines, but again, to do pop-up sites and help people get to those pop-up sites, or if they're homebound, we will come to you. And Thomas, I don't think we're offering any incentive programs. That's correct, right?
Yeah, we're not really permitted to do incentive programs with our federal funding. those are pretty much state launch initiatives. Now, I will say that's kind of a debate whether that really gets people vaccinated or not, if it's people who would get vaccinated otherwise. I think the jury's out on that, but we don't really have the flexibility, the option of doing that ourselves.
Okay, thank you, sir. Let's see, Sarah with Y'all Politics. Are hospitals, doctors being required to keep a list of those who are unvaccinated or just those who have received the vaccine from them? If so, who are those lists being shared with? And will that same idea spread to schools or businesses in the future? Dr. Dobbs?
We aren't requiring that they keep a list of vaccinated and unvaccinated folks. Now, the long-term care settings, the CMS ones, they do have to report their vaccination numbers through NHSN, the Healthcare Associated Infection Prevention, and y'all can see those aggregate numbers anytime you want to. I think about 45% of our long-term care employees are vaccinated. So we don't have a list of who that is, and there could be things that are maintained internally to those facilities, but that's not something that we have access to or have mandated.
Okay, thank you, Dr. Dobbs. Courtney Ann is asking, is there a ceiling on this fourth wave with just over 30 vaccinated plus those who have antibodies from prior infection? Do we anticipate this wave won't reach the same level as some previously? I think we've answered that, but go ahead, Dr. Dobbs.
I don't know that we don't know it's not going to reach that sort of level. I mean, if we look, we've already had these 3 waves. We know that natural infection doesn't give you complete immunity from the Delta variant. And if you do some simple calculations, and if you assumed that all cases were immune and you looked at the number of people vaccinated, you can see that really we're only looking at about 55, maybe 60% of folks who are immune. We have a large population, especially younger folks who would not be immune. So we're going to see a lot more cases going in the next few weeks. A lot of it depends on our behavior, not underlying immunity.
Yeah, because with the first wave, we didn't have the vaccine available, correct?
Mm-hmm.
So now we do. So it would be very sad if we got to that state again. Nick is asking, what percentage of severely ill COVID patients got monoclonal antibodies in time? What else can MSDH do to increase that number? Dr. Ennie, explain what these antibodies are. We have information on our website and certain people qualify. Can you talk a little bit about that? And I don't know if you know the percentage of severely ill COVID patients who got the antibodies in time.
Sure. Monoclonal antibody therapy is used in various other areas of medicine, but these are artificially produced antibodies that are directed specifically going after the COVID virus itself. And so for an individual who has zero immunity, whose immune system has never seen the virus, they may not, if they're infected and have severe illness, they may not survive long enough to mount an immune response. And so by giving the artificial antibodies early in their course of therapy, then we're providing them a chance to combat the viral infection while their normal immune system sees the virus and starts responding to it. And it's just a very elegant way to treat those who are mild to moderately ill in the early stage of their illness, who have high risk factors for going on to have severe life-threatening disease. And it's 75 to 89% effective in reducing hospitalizations. So, and the health department has a very strong push educating both physicians and the public. Where the message is, if you're positive for COVID, talk to your doctor about antibodies, and physicians decide when it's appropriate or not. We even have a tool on our website for physicians and providers that they can go and determine if someone is eligible and in need of antibody therapy, and where they can refer the patient to receive it, because it's not available just anywhere, but it is much more widely available than it has been thus far, and we're promoting it every way we can, including the health alert notice that's Dr. Dobbs is mentioning. This that will be part of that as well, to educate our physicians about using it, which ones are available now, which ones are approved now, and we try to keep our physicians up to date on which ones are effective, since different variants are becoming resistant to the previous antibody therapy. We're having to stay ahead, and we work hard to keep our physicians updated on that.
Okay, so Courtney is asking a question I've been expecting. Dr. Dobbs, your comment from last Friday's MISMA chat, the anti-science Nazis on social media try to find anything to make an excuse, right? We've been dealing with a lot of misinformation, folks, which is why we have turned off our Facebook response, because we're not going to perpetuate misinformation. One state representative sharing the video calling for your resignation. What's your response, Dr. Dobbs? I want to say something first. Nobody in this state has worked harder than Thomas Dobbs, and there does get to a level of frustration that all of us feel as we're trying to get people vaccinated, and we see increasing numbers. And I wish that state representative, instead of focusing on Dr. Dobbs, would talk to his constituents about getting the vaccine. Dr. Dobbs, do you have anything to add?
Yeah, first off, I just want to apologize for kind of getting away from a sense of calm decorum, but I'm frustrated. I'm mad. I'm upset. I'm depressed, because we're going to watch people needlessly die over the next month or two for no good reason. There is a mountain of lies and disinformation that is being promulgated by a relatively small number of misinformed, disillusioned people, and it's leading folks astray. It's very difficult to watch. It's upsetting to see this perpetual nonsense go unchallenged. And I'm here to fight for Mississippi. I'm here to fight for everybody. I know it's kind of difficult right now, and I know there's a lot of hard opinions. And sometimes there's more than one response. I mean, getting vaccinated is our way out of this. This is our mechanism to not have to go through this, without a doubt. But if you're not vaccinated, now's the time to take extra precautions. Take choices for yourself, protect your loved ones, protect your elderly folks, protect your family members who have chronic medical conditions. Do things outdoors, do some common sense things. COVID's killing folks. We know how to prevent that, and we're not doing it. And it's frankly devastating to me personally to have to watch this happen again.
I think it's devastating for all of us that work at the health department. I try to figure out myself, what message am I not getting out there? Why aren't adults getting vaccinated that have children who cannot be vaccinated? It's scientifically proven this vaccine is effective. It is frustrating. And we'd sure love support from everybody. Instead of criticizing, please go out and work to get people vaccinated. We appreciate that. Let's see, Sarah, what are you all hearing as the most common reasons, and Dr. Edney, I'm going to throw this to you. What are y'all hearing as the most common reasons Mississippians still aren't getting vaccinated? Has it changed from earlier in the year? Dr. Edney talks to his patients all the time and has actually been able to explain to some of them to get the vaccine, and they've actually gotten it. So talk a little bit about that, Dr. Edney.
Yeah, it's a mixed bag. There really are a lot of people who are confused, as I had mentioned earlier, and it may have been 6 months since their last doctor's appointment, and they just don't, since vaccines weren't available 6 months ago, they've not had this conversation with their doctor yet, and they've just heard everything Dr. Dobbs is alluding to. We hear it all, from the microchip insertion to the depopulation plan using the vaccine, to the magnetizing people, you name it, we've heard it, and so have they. And they, sometimes there'll be a nurse in the family who is uncertain and is just advising people to wait and watch, or other healthcare professionals in the family. And so they have a chance to talk to their doctor and hear the science, which is what we're about, and to hear the fact that 96% of America's physicians have voluntarily chosen to be vaccinated. That's a powerful statistic. And that the vast majority of people who are being hospitalized and dying are unvaccinated. That's another powerful statistic. And many times when you share those two pieces of information and you say, I think it's in your best healthcare interest to be vaccinated, that patients will agree and consent, and we want the vaccine there to give it right away. But many folks they're confused. They don't know there are too many messages out there because of social media. And so it's now the role of individual physicians and providers to break through the misinformation and speak the truth. We talk to them about their diabetes and hypertension and heart disease. And yes, we talk to them about COVID and protecting them from COVID, which is extremely important. And we deal with all the issues like it was produced too quickly. And we explain the science behind why that is not an issue. And we talk to them, just about the fact that it's not fully FDA approved. We explain what an emergency use authorization is and how very powerful and important that is. And sometimes you have to spend 5 minutes, sometimes you have to spend 20 minutes, but it's worth it if you're able to get your patient vaccinated and potentially save their life or the life of loved ones and their families.
Okay, thank you, Dr. Edney. Shirley is asking, although vaccines are free, some people have expressed concern about getting the vaccine because they have pre-existing conditions and they want to see a doctor first, but they may not be able to afford to see a doctor. Do you think the state's high uninsured rate is hindering the state's effort to get people vaccinated for the reasons I stated? Dr. Dobbs, why don't you take that first?
Any impediment is an impediment, and that could play some role. I mean, without a doubt, everybody needs access to quality healthcare. However we get there, that's really an important piece of having a healthy society. It can be an impediment, but I do want to reiterate, one of the sort of rumors that I've heard people say is I have too many illnesses to take the vaccine, which is basically the exact opposite. If you have illnesses, you're the exact person who needs the vaccine, right? It's exceptionally safe, exceptionally safe. It's, it's very effective. And if you have chronic medical issues, you are the person who needs it more than anyone.
Okay, thank you, Dr. Dobbs. Shirley's also saying that she got vaccinated at a private clinic and no one there ever told me that I had to wait a couple of weeks before I was fully vaccinated. She knew this because of her research. You said you were encouraging private physicians to do vaccinations, but are you establishing any guidelines for them? Yes, of course, there are guidelines. Dr. Edney, take that.
Yes, well, that certainly was inappropriate oversight not to be educated about the vaccine that you were receiving. But, I think the message is being pushed pretty clearly that it takes 2 full weeks after the final dose, whether it's the second dose of Pfizer Moderna or the single dose of Johnson & Johnson, before you're fully vaccinated. But, really we're asking that you don't really change your behavior much anyway. Whether you're fully vaccinated or not, you should continue to take thoughtful precautions. And, and of course, private clinicians have a lot of things going on and they're very busy. And I'm sure that you weren't the only one that was receiving their vaccine that day, and they were doing it in the midst of clinic visits and everything else. So not everything's done every time as it should, but physicians have been given guidance, and the physicians that are our vaccine partners do have guidance and are very highly educated and experienced and do a very good job administering vaccine, because this is just one of many vaccines that they're giving. They're also given DPT, flu shots, Hep A, B series. This is just one of many vaccinations that they're giving. They're experts in vaccination.
Okay, thank you, Dr. Edney. Sarah is asking from Y'all Politics, you may have already answered this, but does the MSDH know how many of those ICU beds are filled with COVID patients? Dr. Dobbs, go ahead.
Yes, there are 419 patients in the hospital. There are 138 COVID patients in ICU and 57 on ventilators.
Okay, thank you. Are those in the slides, Dr. Dobbs?
They are.
Okay, I'll put up those slides on social media. So if you all want to see those slides, they'll be up fairly soon after the press conference. Let's see, Dan Goldberg from Politico. You mentioned before, you don't think mask mandates are coming back, and obviously some people just don't want to get vaccinated. Do you feel hamstrung in any way by the political realities on the ground because you realistically can't mandate masks or vaccines? In some sense, it seems like you have one less tool this year than you had last year. I'll start with you, Dr. Dobbs.
Well, certainly we feel like we have not reached our full potential. The masks became a really kind of a big deal. I was fortunate to just get back from a local National Baptist meeting here in Jackson, and was encouraged to see that a lot of folks who had knowledge being vaccinated recognized that as an additional safety step, and were wearing masks around. And I just thought that was so wise. So the wisdom of it's already there. To be honest, at this state of reality, we'll continue to recommend it, but enforcing a mandate is probably unlikely. So that is one less of a tool, but the masks is not really nearly as good as the vaccine. I'm very discouraged that we're not as far as we are. Now, the good thing is we have over 1 million Mississippians have been fully vaccinated, right? We've had a great response for that subset of the population. It's the other folks that worry me. We're all connected. We're all part of this one big web of health in the setting of a pandemic, and where one of us involved, the other one is going to be linked. So it's a family affair. We really need to be doing it together, and we're not. And so that is disappointing.
And Dr. Edney, I think you've talked about this, but do you have anything to add?
Well, I'm just so grateful that we have the main new tool in our toolbox compared to last year, and that's vaccinations. And then behind that, monoclonal antibody therapy and other great treatments on the horizon. But we just need to put the pandemic out, and the way to do that is to vaccinate our way out of this mess. And we can do it. We can do it together as Mississippians.
And it's truly not a political issue, it's a scientific issue. Would you both agree?
Oh, absolutely. Yeah, the COVID don't vote.
Okay, thank you. Let's see, Nick is asking, what do you think the crossover is between people who are still not vaccinated and people who would obey a mask mandate or a gathering restriction? So Thomas, do you want to take that?
Well, it's hard to speculate. I mean, everybody has their own sort of reasons for different things. Certainly, I have seen a lot of folks who are unvaccinated and wearing masks, and so they recognize it. Some of that, it depends, I think, why your reason is. If you're just absolutely defiant to everything, then yeah, that probably goes hand in hand. If you've maybe seen a bit of information that made you fearful of the vaccine and haven't gotten enough information to understand how truly safe and effective it is, those folks may not be vaccinated but wearing a mask. So there'll be a lot of variability. I think it'll cross the spectrum.
Okay, Dr. Edney, anything to add?
Yeah, some of it is complacency. A lot of individuals have made it very well thus far, and it has not impacted their families directly. And so they may have a sense of undue safety because we're seeing families touched every day by this virus in very, very bad ways. And a very common response that we're getting now when a loved one is deathly ill in the ICU is guilt and shame over not being vaccinated because it was totally preventable, or a patient crying while we're giving the antibody therapy, apologizing because they weren't vaccinated, and we're having to expose ourselves to get antibody therapy in them. And it's just a lot of people have been lulled into a false sense of security just because it hadn't hit them yet. But Dr. Dobbs is right. It's either get vaccinated or get COVID. One way or the other, it's coming.
Thank you. In closing, I'd like each of you to pick one statistic, one startling statistic to impress upon people. We've had some good statistics out there. Dr. Dobbs, I'll start with you. What statistic or what two statistics do you want people, your reporters, to leave with today?
13 ICUs with no beds, right? And we're still early in the Delta surge. It's going to hurt everyone for every disease process, right? It's not just if you have COVID, if you can't get an ICU, it's if you have a heart attack or if you have a stroke, or if you're pregnant and you need some emergency care. It's going to affect everyone. We have once again threatened the healthcare system with an explosion of COVID, and we've got a little ways to go. It's going to be difficult again.
Thank you, Dr. Dobbs. Dr. Edney, I think I can guess what yours is, but go ahead.
All right, so Liz, this is number 3, third time. 96% of America's physicians are voluntarily fully vaccinated. Speaking to the safety of the vaccine, it is safe, effective, free, and widely available. So please get your COVID shot.
Okay, you guys were great. Thank you, Dr. Edney, and thank you, Dr. Dobbs. And thank you to all of you for joining us and asking all your questions. We appreciate your help very much for getting out scientific information. On behalf of Dr. Thomas Dobbs and Dr. Dan Edney, I'm Liz Charlotte, wishing you a good afternoon.